A four-alarm fire in the Bronx apartment complex left 19 people dead, including 9 children. Officials say it appears the blaze was sparked by a malfunctioning space heater. More than 60 people were injured, and officials do expect the death toll to climb. Joining us now is Dr. Ernest Patti, the senior emergency medicine physician at St. Barnabas Hospital in New York, who treated patients brought in from the fire all day yesterday. Dr. Patti, I know the entire city, the Bronx, grateful to you and the work that you did, but I also know it just must have been horrible yesterday.
Thank you, John, for having me. Yes, it was horrible. And you have to remember, we had a tremendous team yesterday at St. Barnabas Hospital. I'm just a small piece of it. We're Bronx strong, and St. Barnabas always rises to the challenge. But I have to say, all of us being parents and having family members and loved ones, it was a really tragic day for us.
You say being parents. Is that because many of the people you were seeing were children?
Yes.
And the patients that you were treating, what were they there with?
The vast majority of patients that came in, you have to remember this was considered a mass casualty incident where we got over 20 patients, actually closer to 30 within a very short span of time. They came in with smoke inhalation, and many came in cardiopulmonary arrest requiring immediate care, that including, CPR and airway secure and a lot of critical conditions came in at one time.
Yeah, smoke inhalation, cardiac care, of course, which speaks to the issue there. It wasn't necessarily the fire itself, it was the smoke that took so many lives there. You say it was a mass casualty event, 20, 30 patients coming in at once. What's that like when you're in the ER?
It's a period where we have to mobilize all of our resources rapidly. We got a quick phone call on our red phone by EMS alerting us that there was a fire in the Bronx close by. And then what we do is we activate our alarms and we get staff from the other areas of the hospital, our critical care unit, our internal medicine unit, the surgery, nursing departments. Everybody converges on the emergency department to help in the resuscitation effort of all these people. We break into teams, and each team then gets assigned to a patient. And basically, all of this happens simultaneously, which is challenging, John.
It's challenging, especially when you know there are more people still coming in. Smoke inhalation, how do you treat that?
Basically, we have to be very careful. It requires oxygen administration. Many times it requires intubating people and putting them on a ventilator or a respirator. Because don't forget, not only is it the smoke that sort of clogs your lungs, it's also the heat that can injure your airways, causing them to swell and preventing you from actually breathing and being able to exchange oxygen for carbon dioxide. It's a very challenging situation. So many of the folks went on ventilators and respirators, and then you send them to hyperbaric chambers. So we actually transferred out a number of those folks for hyperbaric medicine, where you give them higher concentrations of oxygen. So our surrounding hospitals that have hyperbaric chambers helped us out in that venture.
And it's all the more challenging, I know, and taxing when it is children you're dealing with. Dr. Patti, thank you so much again for being with us this morning, and thank you to your entire team for everything you continue to do.
My pleasure. I just want to remember it's the compassion and the human condition. Everybody rose to the challenge yesterday and to try to help our community. Thank you, John.
The community is grateful. Thanks, Doctor.